Diabetes and sexual health. The shocking truth. What if diabetes is stealthily ruining your love life? A 2024 meta-analysis of 15 studies finds 50% of diabetic men have erectile dysfunction, and women face equally serious dangers. Here's what 3 groundbreaking studies just learned, and how to fight back. 1. The diabetes sexual dysfunction epidemic. Let's start with the numbers. A 2017 study found that erectile dysfunction (ED) appears 20 years earlier in diabetics compared to non-diabetics. But it's not just men. Young women with type 1 diabetes scored 28% lower on sexual function indexes compared to healthy controls, according to a 2020 International Journal of Environmental Research study. Scientists tracked 169 women for 2 years using validated questionnaires like the Female Sexual Function Index (FSFI). The results: 1 in 3 diabetic women had painful sex and loss of desire. Diabetes damages sexual health in 3 ways. Vascular damage. Blood sugar corrodes blood vessels, cutting off circulation to genitals. Men can't get erections. Women suffer from vaginal dryness. Neuropathy. Nerve damage disrupts signals between the brain and genitals, reducing arousal. Hormonal disturbance. Diabetic men may have 40% lower testosterone, while women suffer estrogen imbalances. A Norwegian study even found vaginal atrophy in diabetic women as young as 26. A woman with type 1 diabetes described sex as walking on broken glass. Another man in his 30s said, "It's like my body betrayed me overnight." These aren't rare cases. Diabetics are 3 times more likely to divorce due to sexual issues, according to a 2022 clinical genetic research study. But a 2022 Norwegian study revealed a surprising twist. 70% of diabetic women reported sexual dysfunction, yet some had ideal blood sugar levels. This suggests psychological factors, stress over glucose monitoring. Relationship conflicts. The mystery deepens. Now, let's explore the real game changer, the treatments that actually work. 2. Breakthrough solutions. In 2024, researchers tested PDE5 inhibitors, such as Viagra, on 83 type 2 diabetic men. The study divided them into 2 groups. One received lifestyle modification plus meds, the other added sildenafil. After 3 months, the sildenafil group saw twice the improvement in erectile function. But here's the catch. Diabetic men still responded 30% worse than non-diabetics because of blood vessel damage. Testosterone therapy showed promise. Diabetic men with low T who used transdermal patches for 6 months experienced a 15% boost in libido and insulin sensitivity. But there's a risk. Testosterone can worsen heart disease in older men. One 2022 study warned, "It's a double-edged sword, balance is key." For women, the solution is less clear. A 2022 diabetic medicine study found that estrogen creams helped 60% of diabetic women with sexual dysfunction, yet many hesitated to ask their doctors. One woman admitted, "I didn't know diabetes would impact my vagina until it was too late." Tibolone, a synthetic hormone, improved lubrication in trials but remains unapproved by the FDA in the US. The best approach: combination therapy. A 2017 review emphasized that endocrinologists, urologists, and psychologists must collaborate. Diabetic nerve pain, for example, can be treated with low-intensity pulsed ultrasound, while cognitive behavioral therapy helps break the cycle of shame. One clinic saw a 50% success rate combining blood sugar management with sex therapy. Unanswered questions. Gender gap. Why do women's sexual health issues receive 70% less research funding than men's? A 2024 paper called it, Medical Gaslighting. Mental health. Does diabetes-related anxiety cause sexual dysfunction, or vice versa? The chicken or egg dilemma remains. Take action. 3 essential steps. Demand dual checkups. Sexual health screening should be part of every A1C test. Ask, can we talk about how diabetes impacts my sex life? Time Cialis. Take PDE5 inhibitors 1 hour before sex. Studies show peak effectiveness aligns with diabetic blood flow patterns. Laser plus lubricant. Women should apply water-based lubricants daily. New laser therapy can regenerate vaginal tissue. 2024 trials show a 40% reduction in pain. Thanks for watching. Please like